Hello guys, my name is Ali and welcome to my YouTube channel regarding hair transplant. I recently got my hair transplant done, and the reason I have made this channel is because I want to share my progress and experience and journey with you guys. And the most important reason is that I want to answer all the questions, queries and concerns a hair transplant candidate usually have before opting for this procedure. So in this first video of the series of videos, I'll be mostly talking about the pre-operative period and answering questions like how to select the best hair transplant center in your area, what is the best method of hair transplant currently available, how much does it cost, and how many grafts you'll be needing. And in the later part of the video, I'll be discussing about the day of surgery itself and all about the surgical procedure. So to my knowledge, the best method currently available of hair transplant is ICE FUE using sapphire needle technique. And the best way to select the hair transplant center is to review the comments about that particular hair transplant center. And even the better way, if you know someone who has underwent the procedure from the same center, you can get in touch with them and ask them about their overall experience, their level of satisfaction, but most importantly, the results of their hair transplant. So the number of the grafts actually depends upon two things. The one is the area needed to be covered, that is the recipient area or the area of baldness. The second thing is the density of the hair in the donor area. In most of the instances, the donor area is usually on the back of the head. So in terms of cost, the cost depends upon the number of the grafts that will be needed to cover your area. And I'll be mostly talking about Pakistan because that's where I got my transplant done from. And on an average, per hair graft cost around 40 to 70 Pakistani rupees. So if you're opting for 3000 graft, it would cost you around 1.5 to 2.5 lakh Pakistani rupees. So let's just talk about the day your first visit to your hair transplant center. During your first visit, your surgeon will examine your scalp from the front and from the back as well, and he will determine how many grafts you will be needing for your procedure. He will also have a look at the density of the hairs in the donor area. You will be given a series of instructions like precautions to take 24 hours before surgery. These usually include not to take any tea, coffee, alcohol, soft drink, and refrain from smoking. Plus, if you're taking any blood thinner, you'll be asked to stop that as well. This is because all these things causes increased risk of bleeding during the procedure and also impairs wound healing as well. So now coming towards the most important day, that is the day of surgery. So on the day of the surgery, you'll be asked to take a small breakfast from home, and while you're leaving your home, you will be advised to wear a shirt. Yes, this is the bad news for the guys who love t-shirts like me. You will have to get used to wearing shirts for the next 14 days starting from the day of surgery. So once you reach your hair transplant center, you will be given a small tablet of antibiotic drug for surgical prophylaxis. Once this is done, the surgeon will make the boundaries of the recipient and the donor area on your head, and his assistant will shave your head. So let me show you a picture of how my head looked like once these markings were made on my head. So once this is done, you will be taken to operating room. Initially, you will be asked to lie on your side or on your belly, as the surgeon will be extracting the hairs from the donor area, which is on the back of the head. So once you're in position, the surgeon will inject a mixture of local anesthetic and a normal saline solution. This solution actually serves two purposes. It makes your area numb so surgeon can work easily and you don't feel any pain. Plus, it raises the gap between the scalp and the skull bone as well, so giving surgeon more room to work with. So once your area is properly numb, the surgeon will make small punches or hole in your donor area, and his assistant will extract the hair graft from that area. These grafts, as soon as they are removed from your scalp, will be kept in a cold environment. This cold environment actually helps a lot with the viability of the hair graft. This is why the term ICE FUE is used. So I also wanted to tell you that there is a special technique used to extract these hair grafts. not every subsequent hair is taken out from your back. They usually take one hair and leave the next subsequent few hairs, because whatever hair graft they are taking from the donor area will not grow back. So they have to make sure that they don't take hair grafts very close to each other, because this will lead to area of baldness on the back of your head. So once all the desired numbers of the graft has been extracted, they will apply a polyfax or an antibiotic ointment on the back of your head, and they will provide you with a temporary dressing. So once this is done, you will be given a break from the procedure, and once you are satisfied with the break, you will return back to the theater. And in theater again, this time you will be asked to lie on your back. Surgeon will be working on the recipient area. So again, he will inject that mixture of local anesthetic and saline to the front of your head. And I must warn you, if your recipient area is on the front of the head like mine, this injection of the local anesthetic hurts a little bit more as compared to when he was injecting on the back of your head. This is because that the front of the head usually have more nerves that carries the pain sensation as compared to the back, and so the discomfort is a little bit more on the front with these injections. So once your area is numb, again he will make some small punches on your recipient area, and will place the hair grafts after this. Once all the hair grafts have been placed, you will be asked to sit up, and your donor area will be cleaned with saline, and again an antibiotic ointment will be applied on the back, and this time they will apply a proper dressing covering your donor area. The dressing is just applied in a manner that it usually covers the donor area only, and the recipient area is kept open to the atmosphere. So once this is done, you will be shifted to an observational area. You will be kept there for about, say, 30 minutes or so, and once they're happy with your progress, then you can go home from there. So I'll be really very honest with you guys. There were two small things that bothered me a little during the procedure. As I've mentioned before, the first one was the injection of local anesthetic in the front in my recipient area. It did hurt a little bit. And the second was to lie for so long in the same position during the procedure. So once you're ready to roll out of your hair transplant center, you will be given a surgical cap. The surgical cap must be worn whenever you are going out of your home or even going to washroom. This cap serves as a protective measure, and it protects your newly transplanted, really very delicate hair from getting infected or getting in contact with dust particle. But apart from these two times, your recipient area or the newly transplanted hair area should always be kept open to air, as it aids in the healing of the wound. So let me show you the picture of how my head looked like when the procedure was completed. So now coming on to the precautions to take on the day of the surgery. You should be very careful that your newly transplanted hair area should not come in contact with anything at all. Be very careful when you are getting into your car, mind your head. And even if when you're going to sleep, it is advised that you sleep with a straight position. The best way to ensure that is to keep pillows on each side of your head, and it is also advised that your head should be kept elevated when you're going to sleep for about at least 30 degrees. This aids in the absorption of the local anesthetic fluid that they have injected in your scalp, and also reduces the risk of bleeding. Apart from that, as I mentioned before, you're not allowed to wear any t-shirts, and you should refrain from wearing any caps as well. The other precautions include not to take any tea, coffee, alcohol, soft drink, and to refrain from smoking for at least more 48 hours. Apart from that, it is also advised that you keep yourself well hydrated. The best way to do that is to take lots of juices. I would like to mention another important thing. You should not get scared if you see any sort of swelling on your face when you get home. This swelling is because of the solution that they have injected in your scalp, and it usually drains from the scalp to the front of the forehead, then it drains to the side of the head, goes to your face, and eventually draining to the neck. From here, this is absorbed. So in some individual who undergo hair transplant, this swelling develops right from the day of the surgery, as it was the case with me. But other individual might experience this swelling starting from day 3 to 4, but it will fade away or go away in 2 to 3 days. So I am posting this picture to give you guys an idea about the swelling that develop on the day of the surgery. This is the picture when I get back home from my hair transplant center on the day of surgery. And as you can appreciate that there is lots of swelling on forehead and more prominent swelling on the side of the head, giving my face an abnormal look. So thank you guys for watching my video. I hope you liked it. If you have any queries, questions or concerns, you can drop down in the comment section and I'll try to get back to you as soon as possible. Please subscribe my channel if you want to get updates of my newly posted videos. I hope you're doing well in this COVID pandemic. Stay safe, take care, bye bye.